Hello, everybody. Thank you for joining me here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. Every Monday and Friday, 1 p.m. Eastern Time, I'm bringing specialists to answer all your questions and concerns related to COVID-19 and also a lot of questions about prematurity in general. As we know, many education sessions have been canceled in hospitals across the country. So we are trying to provide as much information as possible for families. And if you are at home and has any topic that you'd like us to address, please send us a note and we'll be happy to bring specialists, experts or parents to address those questions that you might have. And today we're going to be talking about something that is so very important for all parents, and all NICU parents are always very concerned about babies feeding. And to address feeding and give us some practical tips on feeding your baby in the NICU and transitioning home, I have Doris Dickson, who has worked as a neonatal nurse, clinical nurse specialist and lactation consultant for over 30 years. Doris has a passion for parents of sick and vulnerable infants. She led key initiatives to change how the healthcare team involved parents in decision-making and in the team. Her work with evidence-informed practice has led to the development of numerous regional guidelines and interprofessional education. These included many newborn feeding resources and guidelines. Doris was also part of the design team for the new Women's and Newborn Hospital in Winnipeg. She has since retired and works as a nursing consultant and as a clinical education facilitator for the University of Manitoba College of Nursing. Doris, you're not really retired. We still have a lot going on. Welcome, and thank you so much for joining us here today.
Thank you very much, Fabiana. The Canadian Premature Baby Foundation is dear to my heart. As you know, when it was first formed, we had a relationship with the organization immediately from my hospital in Winnipeg, and we've benefited here from the resources provided, and we've also tried to give back as much as possible. And so when I retired, joining the board just seemed like a natural way for me to continue to connect with families of premature babies. And so I'm really happy to talk about some practical tips for families. And I will say one of the reasons why I like to focus on the practical is because I think it's easy to find the theoretical information, and parents who are in the units get a lot of that from nurses and physicians and occupational therapists and lactation consultants. But sometimes the practical tips aren't as easy to come by. And over my 20 years as a lactation consultant, I've gathered a lot of practical tips that I found help a lot of people. So I'm really excited to do this, and I'm happy to start answering your questions.
Thank you, Doris. And we're so grateful to all the work that you do for CPBF and also for all the families. So let's start talking about the baby is born extremely preterm, and sometimes parents come into the NICU, we don't really know how to feed the baby or how to prepare the baby for feeding. I had no idea I had to pump for so many months, and I wasn't going to be able to breastfeed for a lot of weeks. But how do we prepare the baby to start or the first steps in the NICU that parents are going to experience?
Okay, so the first steps in the NICU, really, regardless of what your plans for feeding are, and I think it is important for moms to take a step back in terms of their long-term plans for feeding and work with their team with provision of breast milk, if possible. And I recognize a lot of mothers with babies where provision of breast milk is very difficult. So regardless of how you're feeding your baby or how you will eventually feed your baby, really it starts as soon as you can do skin to skin. So skin to skin is really the first step towards feeding babies. And now I'm a huge proponent of skin to skin kangaroo care, and I could talk for an hour about that, but we all know that that's really, really important. And it's also your first opportunity to start building that relationship with your baby. And feeding is about relationships. That's why we have family dinners, because we eat together and we build and restore relationships and strengthen relationships by eating. And babies are no different. So when you start with skin to skin, pay attention to the environment that you're in. Control as much as you can, light, sound, your comfort. You need to be comfortable. And if you need to remind people to take the sound down, do it. Advocate for you and your baby as much as possible. Too much light is overwhelming for babies. Premature babies are easily overwhelmed. And so what you want to do is have the only sensory that your baby gets being you. So remove as much of the other sensory inputs as possible so that you and your baby can focus on each other. So that's really your first step in building that relationship. Your baby gets to know you and how you move and how you feel and how you smell, and you get to know your baby and how they respond to things. And even if you're not making enough breast milk, or even if you've always planned to bottle feed, that doesn't mean that you can't bring your baby to your breast. Very important early steps is that your baby should go to a pumped breast, because you really don't know what your baby's going to be able to do. And I'm talking about babies born less than 33 weeks. So anybody from 22 to 33 weeks really should start just with playing at the breast. And that is something that you do when your baby is in skin to skin and is telling you that they're awake and alert, and they start to look for it. So it's very safe to do it if you've already got a pumped breast. And to be honest, the small babies really don't have strength to draw a lot of milk. But that gives you the opportunity not just to build a relationship, but to practice positioning. It's quite different than your previous babies who were maybe full term and bigger. And sometimes, moms kind of forget, if they have more than one preterm baby, what it was like to handle a baby that was 2 pounds, 3 pounds in feeding. So you get to practice sort of how you're supporting your baby, how you support the breast. Practice getting them on the target. Pay attention so you can watch them, because you're not really worried about how much milk they're taking in those early times. That's playtime. And really, it needs to be a positive time. You need to be happy. The baby needs to be happy. You need to be relaxed. A lot of moms put a lot of pressure on themselves, and they start getting really tense up in their shoulders. And I often say, involve your partner in making sure that you're relaxed. So your partners want to be there. Your partner, your best friend, your mother, I've had grandfathers want to be there for these feeding times. Give them a job to do. Their job is to relax you. Massage your shoulders, watch your posture, so that everybody has a role to play in making this a really positive experience.
Absolutely. Of course, now it's a little bit different because you cannot have a lot of access to visitors and the other parent in the NICU at the same time. So let's hope that the situation will change soon, because those are excellent ideas on how to support the lactation parent, for sure. Doris, how about NNS? We hear NNS all the time when we're in the NICU. What's that, and how does that help the baby?
So NNS, non-nutritive suck, really is stage 1 of feeds. So it really is a learning phase. At the beginning, you do skin to skin, and you slide your baby down to the breast. So now you actually let the baby suck. And this gives you the opportunity to really pay attention to the positioning the baby has. So NNS can be with a soother while they're getting a tube feed. And that's important because it starts to associate sucking with their stomach filling. And it also gives those muscles an opportunity to develop. So really important that they get those sucking opportunities. You can put the baby's hand in their mouth. They love that. It's also very self-soothing, and you encourage them to self-soothe. So you can use the baby's hand, you can use a soother, or you can use the breast when you're doing skin to skin. When the baby is in those early skin to skin times, pay attention to their position. Think about yourself. Take a cup of water, or in this case, coffee. Now try to turn your head and drink. What happens oftentimes, and I do this with groups of students, is they're dribbling water down their face. It's very uncomfortable because that turning of the head or lifting up like this changes the position of your esophagus. very uncomfortable position to drink. So picture your baby, and this is where you start to put yourself in your baby's shoes. Picture your baby on the breast, turning for the breast, or stretching for the breast. Very uncomfortable. And then we're surprised when the baby starts to fuss. So your baby is telling you something in their own language, and their language is all body language. You've got to pay attention to that. So non-nutritive suck is a way where you can practice that when there's no pressure. So you can practice, support the baby's back along your arm so that the back is straight, so that the head isn't turned, so that they're not twisted, that they're really in a nice belly to belly position with mom, and they're nice and straight. So that's what you're looking for, a nice straight line from the ear to the hip, from the nose to the belly button. So that baby's in the perfect position that they're comfortable. And then if they just get on the breast and go to sleep, they're telling you something. I get so many questions from moms. My baby's sleepy. What can I do to get them to suck? And I said, well, you got to step back. What did you just say? Your baby is sleepy. That's your assessment. Your baby's telling you, I'm too sleepy right now. Don't push the baby. My baby's fussy. It means they're not comfortable. Maybe they needed a diaper change or something like that. So really pay attention to what your baby is telling you and do something to what the baby needs, not to what you want the baby to do.
But Doris, how do we know the baby is ready to even start? Because obviously the 23, 24, 26 weeker, sometimes it's hard to read the clues because we just gave birth, we're learning this whole new world. So how can we find a tune, but also see if the baby's ready?
Baby's readiness is, again, something they'll tell you when they're bright-eyed. Like, you can't force a sleepy baby to eat. So that's telling you they're not ready. Fussy, they're not ready. But wide-eyed and alert is part of readiness. And the next step is, okay, put them in a really good, comfortable position, give them that opportunity to eat. And even if it's a bottle, put them in a comfortable position and see what they do with milk on their mouth. So that's the next step. The first step is the position and the suck. The next step is, what do they do when they actually get milk in their mouth? And then you will watch them closely to see what they do with it. And if they swallow it and they don't have a spell, that's a sign that they're ready to start. If they have it in their mouth and they freak out or get fussy or get sleepy, then it's a sign that they're not ready. So it's more about reading the not ready signs than reading the ready signs, because we're always ready, but we're not always in tune to the not ready. So you have to really watch for those. And you do have to be careful that you don't push them too hard, because they will use up more energy than they've actually got and end up sleeping the rest of the day. So you want to also be a pacer with that readiness. But it starts with the suck, and then the next step is, what do they do with milk in their mouth? And then the next step is, can they sustain it? So sustaining the suck, taking more than one suck before needing a break. So taking a few sucks in a row and then taking a break. On the breast, the baby will actually kind of self-pace. They'll just stop sucking, and it's very safe. With a bottle, it's a different story, because as you know, you turn a bottle upside down, it just keeps dripping. So you can really overwhelm a baby with not pacing them with a bottle. So you really need to know how many sucks in a row is baby taking, and then you pace them by tipping it back. So readiness is more about not readiness and being very alert. And it's better to take your time. And patience is a word I'll use continuously when I'm talking to moms about feeding. Have patience.
Absolutely. And I think that carries on for the rest of your life as a parent.
Yes.
But I want to go back to that when you talk about closer to going home. But before that, I want to ask a question. How we talk about baby being prepared for feeding. How about the parent? Do the parent have to be prepared for feeding the baby in the NICU? Because it's obviously very different than what we had imagined of feeding your baby at home. So how can we prepare a parent in the NICU for feeding?
A really important part of preparing the parents is being an active member of the team, really getting to know who is your baby's team. And I know it's so challenging in these times when limiting hours are limited, and you know, you can't have as many other people. Now, the other side of that is that you don't have a lot of other distractions when you are there. But make use of the telephone. One thing that I've heard parents say is that the phrase, "I didn't want to bother you." And really, right now, it is very important that you bother them, that you talk to them. Find out who the occupational therapist is in the unit and find out when they're there, or leave a message for them to phone you so you can talk about it, so that they'll share their assessment with you. Some units will let parents read the chart so that if somebody came in while the parent wasn't there, they can read to them the assessment that's written in the chart. So preparing you is really educating yourself about what others are seeing with your baby. What is their approach? What are their plans? Ask, ask, ask. Ask to see a lactation consultant if they have them. Ask to talk to the doctors. Ask, ask, ask. Don't be afraid to bother the staff, because in reality, you and your baby will do better the more involved you become, and you'll feel more confident. And confidence is going to save everybody frustration and time and energy. So, you know, really prepare yourself by just really immersing yourself. And if you don't understand something they say, don't hesitate to say, "I don't really understand what you're saying," because I know healthcare workers really well, and we tend to fall into our own language. And it's a whole new language for families, and we forget. Like NNS. What is NNS? Well, that's an abbreviation that we use. But if you don't understand what it is, tell us and force us to explain what that terminology means.
But also, Doris, you mentioned talk to your healthcare team, but also planning with them, because they have the plan for the day. But it's so very important for the family to be involved in the plan for the day, because then the nurse know, okay, mom is coming this time or dad is coming that time. I want to be here for feeding, because there's sometimes some miscommunication, right? The nurse don't know if the mom is going to come, but when you plan together, I think you're setting yourself up for success along the road of feeding and all the way to discharge.
Absolutely. When I did my thesis research, I interviewed 50 mothers at home 6 weeks after their babies were discharged, and these were all small babies. And the most frequent frustration they voiced to me was when they had made a plan about when they were going to be there, and when they arrived, the feed was already done, and it was all about the communication. So, you know, if you know that a shift change is going to happen in between you talking to them and you arriving, find a way. So use communication boards, leave a big note, find ways to make sure that that communication gets passed on, because we all know how busy units are. And we all know that people are going to make mistakes or omissions, and something you tell the morning nurse may not get passed on. And that's just the reality of busy units. So if you need to invent your own communication system, do it. If you need to phone them more often and say, "Don't forget I'm coming in." So be really proactive in that communication.
Absolutely. So very important for families to really try to understand that as the unit is busy, but also the role that you have a role, and your voice can be heard in the NICU, and let's work together to make things better for the baby, because that's the goal, to get the babe out of the hospital. And that's the next thing I want to talk to you about, because we talk about these early preterms, but now they're getting ready to go home, and now ideally want them in full feet before going home, and sometimes there is a rush, a sense of urgency to get baby to eat everything, every single feed, finish the bottle, or empty the breast. So, and you want to encourage the baby to take more, but what happens when you push those babies too hard?
Well, that's when you're transitioning to home, that's another phase for families. And often that's, again, a phase where the stress levels start to go up. Stress is high at the beginning, then you kind of get into this sort of complacency, baby's learning, baby's growing. Now you've hit the baby's getting close to going home, really turns up the heat for families. The stress levels for the family goes up, but the staff stress level, they've decided you're not a sick baby anymore. So they have a different approach too as well. So it's important to recognize that their stress around your baby is going down and your stress is going up. So again, working with them, not making their stress go up, but working as a partner to help alleviate your own stress, and really take a breath and have patience. At the end of this hospitalization time, the baby is learning a lot of things, and you really need to let the baby learn it at their own pace. If you start to push baby, and there will be a time, and unfortunately, I've often noticed those times happen in the middle of the night, where a baby will suddenly take a full feeding, and it was like never taking a full feeding again. Well, the group in Alberta, they developed a feeding protocol called SYNC, and they really emphasize limiting and pacing. So limit the volumes that the baby takes until they prove it. So you will let the baby prove that they can get to the next stage, and do it very gradually and stepwise. They looked at 1,500 charts, and what they found was that if a baby suddenly took a full feeding when they were at less than half feedings before that, they suddenly dropped off and didn't have the energy for maybe a day, maybe 3 days, because it overwhelmed them. So you have to be really careful in this assessment of readiness, and kind of be smart about it and say, I'm going to limit you so that you have enough energy for the next feeding. So you can't push the baby faster. But what they found was that the babies kind of go up in stages, and they would go up one stage a week, one stage every 4 days, one stage every 3 days. But towards the end, they start to go up stages more quickly if they're not pushed. So they'll suddenly learn a lot because the maturity starts to click into place. So wait for the baby's maturity to click into place. It's kind of like toilet training. You think you're going to toilet train at 2 years old, but your child has a different idea and their body isn't ready. And you can't force them to toilet train at 2 years old. And I know this from experience. But if you have patience and try some strategies for assessment, they'll do it when they're ready. So it will click when they're ready. And it might be sooner than you think. If you think it's going to take another month and it suddenly only takes a week, it's because you waited. So that's a really important thing, is to stick with the plan, be consistent, and be patient.
Absolutely. Thank you, Doris, for that. And I also want to talk about oral aversion, because a lot of babies born preterm have oral aversion because everything that is bad happens around the mouth. How can we avoid that and set up baby for success?
Oral aversions are a big challenge, and they're especially a big challenge for families at home because the suck reflex doesn't fade until 4 to 6 months after their due date. So they're long gone from the hospital. And the suck reflex means if you put something in their mouth, they'll suck. So you can force feed a baby because of the suck reflex. And then suddenly the baby becomes 6 months old, 5 months old, and they start refusing feeds because the suck reflex is gone. Now the baby's in control and you have an oral aversion. One of the things, obviously, that contributes to oral aversion is all the tubes in their mouth. And many units have gone to using softer tubes, replacing them less often so that there's not as much trauma in the oral cavity. That's something you can advocate for if possible in your unit. Some of the early times when they're doing oral immune therapy is what some places call it. Really, that's just putting little tastes of breast milk in their mouth while they're getting fed, makes it a positive experience. So again, it's about positive things to balance out. Now, when they're starting to feed, babies born early have a lot of spells, and everyone knows them by different names, A's and B's, apneas and bradycardia, spells, What does a spell feel like? Well, I want you to think about when you were a kid and you went swimming. Remember diving into a pool or a lake, holding your breath and going deep. Now you go a little bit too deep because you really want to prove something. How does your head feel? Because now your carbon dioxide levels are rising, just like a baby having a spell. You get dizzy. Your head feels kind of funny. You might even feel nauseated. When you come to the surface, if you've gone a bit too far, you might even actually feel like throwing up. So when you think about a baby having a spell, they have a spell and their carbon dioxide levels rise. Now, mom puts the bottle back in their mouth or tries to put them to the breast. How do they feel? They feel sick. So now they start to associate feedings with feeling sick, because spells make them feel quite ill. And sometimes they need a little while to recover from any kind of spell. So the most important thing to do to avoid oral aversions when you're feeding is to stop the feed when there's a spell, because they're not feeling sick before the spell when they had the feed. And then they have a spell for whatever reason. And often it's not because of the feed, it's because of their physiologic condition. Stop the feed. No more feed after the spell. Give them time. Finish the feed by tube or whatever, and then try again next time. And that's very important with those early feeds. A spell means stop. And then you're kind of setting up your baby, A, to recover from spells more effectively, and B, to not associate the feeding with that feeling of sickness from the spell. And that really goes right through. Don't push a fussy baby, because then they'll associate feeding with fussiness. So it makes it a bad experience. So that's really the key to avoiding oral aversions.
Wow, that is amazing. I wish I knew that many years ago. But Doris, let's change gears a little bit and talk about those late preterm babies, because everything that we talk about now is really more appropriate for babies who were born extremely preterm and getting ready for home. But you said babies who are born after 34 weeks have a completely different experience with feeding. Let's talk a little bit about that.
The late preterm baby is sometimes one of the more challenging babies for public health nurses and pediatricians, because they can fool you. And there's so many. And they fool you by being gung-ho and full of vim and vigor in those early weeks. And so we pretend they're full-term babies and we feed them as if they are. And then all of a sudden they come back to an office and they're failure to thrive, because they've gradually fed less and less. They're starting to run out of energy, and they gradually take less and less milk. Mom's milk supply is dwindling and the baby is failure to thrive. So they are really a challenge in that we have to take a step back and say, we almost need to treat them in a similar way to that preterm baby going home, with a little more flexibility. And so the plan that I know we used it in Winnipeg, in our entire province, really for many years, is to actually put those babies on a bit of a schedule, so that we don't allow them, because they'll sleep for 5 hours sometimes. And you think, hey, they're sleeping through the night. And I'm thinking, no, they're sleeping through the night. That means they have to pack in all of their feedings in fewer hours, and they just can't keep up. So you really do have to wake them up at night. You really do have to keep an eye on sort of every 3 to 4 hours, making sure they feed, and really pacing them so that they get all the feed that they need, plus all the sleep that they need. And it's really important not to rush them. Sometimes a switch goes on when they hit their due date or thereabouts, and they start to act more like a term baby. One of the ways, and it's really similar to the preterms that go home getting supplements, and a lot of these late preterm babies will say, go to the breast for 10 minutes and then bottle for the rest. And so that really is the same as the supplements that the very preterm babies are getting. What you start to notice is that the baby starts to be more satisfied with their time at the breast, and they get more efficient. And then that extra supplement, they're taking less and less of it. because they're actually getting more efficient. So the baby tells you when they're ready to drop the supplement.
Wow, that is a lot of good information there, Doris. So my next question is, so now baby's going home, like baby's transitioning home, you know, you get all the schedule from the NICU, you leave it to your schedule, let's feed every 3 hours, every 4 hours. And when we come home from the NICU, it's a little bit of overwhelming for parents. When can we actually relax from that schedule and make sure babies is still growing, is still on a healthy growth curve, especially now when a lot of appointments are being done online? So how can we assure parents, okay, it's a time to relax now, you're okay, or you should be concerned?
Once your premature baby's at home and now you're in charge, taking that plan and being part of the planning, first of all, is very important, because they'll give you a standard plan, but they'll forget you've got X number of other kids at home. You've got all of these responsibilities. You've got a different schedule than the mom in the next bed in your household. So you have to make that plan fit with your household right from the get-go. So you've got to sit down and talk to your team before you go home about what is your home schedule like? Is this actually going to work? That's step one. Step two is, who's your help at home? A lot of times I find families are reluctant to accept help. Nowadays, you got to look at your COVID bubbles and see who are you going to let into your bubble to help you, because you will need help, and accept the help. And maybe that help is somebody who's going to come and cook for you, or someone who's going to clean your house, or something like that. You want to be able to focus on your baby so that you can really tell how your baby is responding to home. So that's important. Accept the help you can. And then the third thing is, how do you know your baby's thriving? A lot of the supplements that your baby sent home with comprise extra protein, for instance. Protein is so important for brain growth, and brain growth is really sets you up for life. So it's really extremely important. Well, how do you know your baby's brain is growing? Their head is growing. And there are some really simple ways for you at home to watch your baby's head growth. It's easy to see if they're getting chubbier. You see their ribs or you don't see their ribs. You see the rolls develop, that's easy. But head growth is something else. And over the years, we learned that we could make babies fat and not have their heads grow. So you want to make sure your baby's head is growing. Learn how to measure their head. A lot of people have little measuring. You get one of those paper measuring tapes from the hospital, take it home with you. And then just learn how to measure their head. It's very simple, above the ears, the biggest part of the skull. You could do that at home, especially if a lot of your visits are now virtual. Watching the head grow equals brain growth. So that's something that you can use to sort of validate that you're doing a good job. And that's what you really need to know. I'm doing a good job. I'm doing fine. I don't care if there's dust on the floor. I don't care if the other kids' toys are all over the living room, whatever. Their overall health is the most important. So learn where you can compromise and where you can't.
Absolutely, this is so important.
Yeah, yes, it is. So I hope those were some decent practical tips that can help you get through that difficult time. I'm not sure if you have any other questions, Fabiana.
So there are a few comments on the Facebook Live that if after the live, if you want to go there and check it out. And I want to thank everybody who joined us here from across Canada. Doris is here live from Winnipeg. But Doris, I wanted to give a last message for parents, because it's such an overwhelming time in the NICU, especially now with the pandemic, but also it's very stressful for families transitioning home right now. And as you mentioned, it's hard to for some parents who ask for help, and this time you really need that help, because we had to take care of our babies as well as our mental health. And sometimes letting go and put sunglasses inside the house so you don't see the dust is necessary. So one last message for the families who are watching us there.
Your baby's overall health is the most important thing, and feeding is really a key aspect of that. It's also your best opportunity to build a positive relationship together. If feeding times are positive for both you and your baby, you really are setting yourself up for success. So set aside all the rest of that. And, you know, if their diaper doesn't get changed as often, if the clothes aren't quite as clean as they could otherwise be, but they're happy and you have a good relationship with them, that will set you up for success down the road. So I wish you all the best.
Oh, thank you, Doris. So there are questions coming. If you can join the live, the comments below, the Facebook live would be great. But thank you everybody for joining us here today. It was a great conversation with Doris as always. And on Friday, I will be chatting with Dr. Stephen Miller. He's the head of neurology at the Hospital for Sick Children. And you're gonna talk about the preterm brain. And on Wednesday, 1 p.m. Eastern Time, Kate Robson, who is a psychotherapist and also a mother of two preemie girls, is hosting a real-time peers group here on Facebook. And to join her group, you can join the Canadian Preemie Parent Support Network, which is our private Facebook group for parents only. Thank you, everyone, and be well.
Thank you. Bye-bye.
Thank you, Doris.